Good morning, friends. Today we will talk about pelvis. Pelvis is a part of abdomen and it can be divided into abdomen proper and pelvic cavity. So pelvis is the place where it is surrounded by pelvic bones and it has some pelvic organs. So today we are going to talk about the pelvis and in next lecture we are going to talk about perineum. So pelvis is a word that is sometimes used interchangeably to describe different structure. Here we are going to use pelvis as the entire region of lower trunk and its anatomical concepts. तो जितना भी लोअर ट्रंक है उसका एनाटॉमी है वो सारा है pelvic के लिए पढ़ेंगे. So the following terms you can see the bony pelvis. It is the skeletal part, the bony part है like ilium, ischium and pelvis और पीछे के साइड में sacrum. This acknowledgement. So this constitutes the bony pelvis. And then there is bony cavity. It is the enclosed space of trunk inferior to the abdomen, which is shown here in purple in color. So these two are the basic term bony pelvis and bony pelvic cavity. So we have to go through first the pelvis. So there are some terms which we should clarify ourselves, like how many types of pelvis is there. So basically, functionally, it is you can say it is true pelvis and false pelvis. So if you see the true pelvis, it is also called as lesser pelvis and it is totally surrounded by bony parts. So inferior portion related to lower part of pelvic bones, sacrum and coccyx. This is the space where fetal head passes through bones during the labor. So जो labor pain होता है जब labor होता है then this is the place where the head is usually get fitted and then move. This is true pelvis. True pelvis is totally covered by bones. You can understand. So what is false pelvis? False pelvis is also called as greater pelvis. ऊपर वाला part होता है. This superior portion related to upper part of pelvic bones, lumbar vertebrae. Actually, some say it is the part of abdomen also. So this you have to understand. So you can see here, if you remove this color, this front part, which is the part of also the true pelvis, is not covered by the bones. So simply we can understand the part which is totally covered by bones. It is true pelvis, which is lower part. The part which is not covered fully by bone or entirely down by bone, it is false pelvis or greater pelvis. Then there are two words inlet and outlet. So the superior and inferior border of true pelvis are marked by pelvic inlet and pelvic outlet. Remember, this is only for true pelvis. These are some ring-like structures which we require inlet. This particular part, the upper part will be the inlet from which the things are going to come inside the pelvis, and outlet will be the lower part, which means the bigger inside, from where the things are going to go get out from this pelvis. So this is inlet and outlet. Remember, the inlet and outlet is only in the concepts of true pelvis. So what is the function of bony pelvis? So function, as you can see, this is made by the different bones. So we have function of framework of let's see. First of all, it connects the axial skeleton with the legs, lower extremity. So axial skeleton part and vertebral column, lower part will be the sacrum and it is connected by the ischium, ilium and pelvis. And then the lower legs are going to be connected or lower limb is connected. It allows the effective weight bearing. This is the bulky bone, so it allows the weight. It provides a sturdy framework to protect the important organs contained within. There are many organs contained within. If you talk about Ayurveda point of view, there are some one point also which are placed inside it. So we have to save this. So this is all basically the function of the skeleton only. And here you can talk about the special point. Now, what is basic anatomy of this? So you should know that polypelvis is about ilium, ischium, and pelvis. These bones are connected at the acetabulum drop, that cavity which is present here this side. This is the acetabulum. Then this particular part is sacrum, which is coming from the posterior side. That is the part of vertebral column comprised of five fused vertebrae. And then there is tailbone coccyx, which articulates with sacrum as a terminal end of the vertebral column and is considered as the part of bony pelvis as well as. So this is the anterior view which we are seeing here. So you can see this part is ischium and ilium part is upper part with ears के जैसा होता है. Then pubis is the front part just behind your buckle of your bed. Whatever you see, it is pubis suffices actually. Then you can see septum and then the lower part will be the coccyx. So these are some basic bones which are present in the bony pelvis. Now some special features or points, because you can see these are not the smooth bones, so there are many grooves, there are many surprise type of things which are present here. So different bones, you are going to get different features. So here it is in together, so we have to see in together only. First of all, you can see this is iliac crest. Iliac crest is between the posterior superior iliac spine and anterior superior. This is posterior superior iliac, this is anterior superior iliac spine, and both in between both there is iliac crest. Then you can see pubic symphysis. This part, what I told you before, also just behind your buckle of your belt. It is the used as a landmark for measuring the fundal height or height of the top of the fundus. But this is also word symphysis is the word which is for the especially cartilaginous joint, so which are slightly movable here. Then you can see there are some openings that is called an obturator foramen. Obturator foramen is opening through which nerves and vessels pass from one place to another. Now, what is foramen? Foramen is the opening which allows the muscles, nerves, arteries, veins, etc. to pass and connect to the other. And they are actually surrounded by the bones, especially. This is obturator foramen. Now, here there will be some difference between male and female pelvis also, which we will talk about later. Then you can see it is anterior superior iliac spine, ASIS, is the easy to palpate and therefore a common used landmark. This is the point from where many muscles are going to get originated, especially as you can recall that sartorius. From here only it is the inguinal ligament which is going to attach from ASIS to pubic symphysis, pubic tubercle. So there are many things which are arising from anterior superior iliac spine. Then there is ischial tuberosity. This part, this is the posterior inferior aspect of ischium, is important site of lower limb attachment. यही वो पॉइंट है जिसके ऊपर हम लोग sitting actually right now. Then ischial spine, this particular point, ischial point, it is used to as a landmark in the descent of presenting part of fetus during childbirth. It can be felt by inserting the fingers inside the vagina. So these are some landmarks which are present on the anterior side. Let's see some landmark on the posterior side. So again, you can see there is a interest. We have already talked between PSIS to ASIS, then obturator foramen. Then here comes a posterior superior iliac spine. This is posterior superior iliac spine. So this is also again our attachment point for many ligaments of pelvis. Then again ischial tuberosity and ischial spine. So these are some landmarks, some bony landmarks which are present on the pelvic bones. So how to understand the orientation? So it is not just straight in line, it is little bit tilted. In anatomical position, the pelvis is tilted slightly anterior side, where anterior superior iliac spine and pubic tubercle comes in the same line. So this is ASIS you can see, and this is pubic tubercle, and they both will fall in the same vertical plane. Then you can say this is the correct orientation of your bony pelvis. So there are some variations of differences between male and female body pelvis, and again in female also there are many different types of pelvis. So traditionally you can say there are either gynecoid or endoid. So despite the name, this is not exclusive for gender. You can say gynecoid is female yoga and endoid will be male or it can be present in any of them, especially female. All three of them are present. One more is there. So despite the name, there is nothing important common. So gynecoid and pelvic active for the three main legs. तो कैसे पता चलता है? So first of all, pelvic inlet shape. You can see the shape of the endoid is the heart shape and gynecoid it is the circular. Then angular pubic arch is small in endoid and bigger in gynecoid. Size of ischial spine is again small here and it is broader here. So again you will see all this again. You can see first of all heart shape, then it is endoid, mostly found in males only, and gynecoid it is circular. Then angular pubic arch will be smaller and pendant and it is wider. Ischial spine ka size again smaller in endoid and greater in gynecoid. So most of the research on the shape and size of pelvis has been done on the Caucasian North American women. Therefore, the current research does not have a full spectrum of pelvic shape. So there are many differences as per research and fact. So it is in the clinical correlation also gynecoid pelvis and birth. So gynecoid pelvis is often described as optimal feature. ये ऐसा pelvis is the optimal feature for process of vaginal birth. But there are very differences also, and then also some pelvic vaginal deliveries possible also with certain efforts. Now talking about ligaments which are present here. So ligament basically there are two sacrospinous and sacrotuberous. Sacrospinous ligament, as you can see here, it is elongated triangular shape, apex attached to the ischial spine. This is ischial spine and this is coccyx. And the base attached to the margin of sacrum and coccyx. This is sacrospinous. Now next is sacrotuberous, this part. So it is again triangular shaped ligament. So it's on the superficial to sacrospinous ligament. This is more superficial. Attached to the ischial tuberosity and PSIS, lateral margin of sacrum and coccyx. So these are two ligaments which are present in the pelvis region. Next, there are some spaces, there are some openings. So these spaces between ligaments and bones serve as the passage between the pelvis and lower limb. तो ये कनेक्टर्स होते हैं जो pelvis और lower limb कुछ भी नर्व पेन आर्टरी कुछ भी जाना है तो इसी के थ्रू होके जाएगा. So you can see first is greater sciatic foramen. It allows the communication between the lower limb and gluteal region. Then lesser sciatic foramen. It is communication between perineum and pelvis, and then there is occipital canal. It allows the communication with the adductor region of the lower limb. So basically, there are three things. First is greater sciatic foramen, which is actually for the lower limb and gluteal region. Then lesser sciatic is for the perineum, and occipital canal is again for the adductor region of the lower limb. So there are several muscles. So basically, there are only two large muscles which we are going to talk here. The first is piriformis. So origin of piriformis is the anterior aspect of sacrum. Insertion will be on the posterior aspect of femur or the posterior lateral wall, like this. Shape is triangle shape. And then there is occipitalis internos, which is covering the occipital foramen. So it is occipital membrane exists in the lesser sciatic foramen. Insertion is on the posterior aspect of femur, making up the anterior lateral wall, and it is fan set. So these are two important muscles which are present here. Next, talking about the pelvic floor. The pelvic floor is basically a muscular thing, which is just like a bowl-like thing, having some muscles and fascia, and marks the border between the pelvis and perineum. So it supports the internal pelvic organs. That's all. And the musculature of pelvic is also closely within the bowel, movement, bladder, and sexual function. There is levator ani. It is basically three smaller muscles which are grouped together. They are called as levator ani. Iliococcygeus, pubococcygeus, and puborectalis. So these three are present in this particular region. That is levator ani. Again, you see this part. This is levator ani. Having three things: ilio, pubic, and pubo. Iliococcygeus, pubococcygeus, and puborectalis. And then there is coccygeus. Last one, the lower one. That is triangular muscle from the ischial spine to coccyx, which is bordered by levator ani and piriformis, the previous muscle division. So this is actually the superior view. When you are going to see like this. Now when you see from the inferior side, same muscles, just view will be changed here. You can see the view is changed, the process will be the lower side. Okay. Now, what is the importance of this? So there is some functions called Kegels exercises or pelvic floor exercises, often referred as Kegels, aims to strengthen the area through the alternating contraction and relaxation of pelvic floor muscle, especially levator ani. जब अच्छे से करते हैं then क्या होता है? Then pelvic floor exercise can minimize the inconvenience, reduce pelvic solvent tolerance, and increase the sexual health. It is something like movement in our sense, which is described for same function. Next, talking about innovation. So you can see there are one plexus is there called sacral plexus. This particular part is sacral L4 to S4. Then pudendal nerve is basically come from the S2 to S4 is there, and it basically supplies the perineum, venous, and clitoris. Then there is sciatic nerve, is the bigger nerve which goes to the lower limb also. So there are coming from the L4 to L3, lower limb passes the pelvic epiphyseal that is sciatic foramen inferior to piriformis. तो इसी में आने से भी disease होता है या inflammation होता है जो called as sciatica. Then there is autonomic plexuses. So sympathetic plexuses and parasympathetic. Sympathetic will be coming from the hypogastric nerve from the sacral sympathetic nerve. Parasympathetic will be coming from pelvic sphincter nerve from hypogastric plexus. If you want to see the dissected view, so you will see these are the sacral plexuses. L4, L5, S4, S2, S3, S4. Then inferior hypogastric plexus in this part of the superior hypogastric plexus. And the last part of this thing is blood supply. So when the blood supply is coming from the Anti-abdominal aorta through common ileum will divide by internal iliac and external iliac. Then internal ilium will divide anterior trunk and posterior trunk. Anterior trunk will go to the pelvic viscera. Posterior trunk will go to the lumbosacral and superior gluteal muscle. External iliac to lower limb तरफ जाएगा. So this detailed blood supply will be again coming when we will talk about next part. In the second you can see some big artery. You can see this is abdominal aorta. Then you can see the common iliac artery. Then further it is divided into common iliac. You can see common iliac, then internal iliac, external iliac, and these then are going to get into the further divisions. So this was some short lecture about the bony pelvis explication and the pelvic floor. In next part, we are going to talk about the perimeter. Thank you.